All right, welcome back. Now we're talking Lassa fever, and it's spreading in Nigeria. As we speak today, 76 people have died of the disease, and of course 64 local governments have been affected, 64 local governments in the country. The government says it has confirmed about 212 cases. Now these are the figures we have, and there's every likelihood that that figure may have changed, but the current figure we have 76 dead and 212 cases confirmed. Of course, as you know, in Lagos recorded its first death on Tuesday, and that death, of course, has been confirmed by the Lagos state government, and we still have 2 more cases, and we just wait and see what happens. The Lagos state government has actually sent sanitary officers to go from markets to not just fumigate this market now, but to place baits at various markets to catch and kill rodents. Now, the question is, just why is the death toll of the current Lassa fever outbreak so high, and why is the disease spreading so very fast? I'm now being joined on the program by a consultant virologist at the Lagos, that's the University of Lagos, I should say, the University of Lagos, as the University's College of Medicine now, I should say. Professor Sando Milabu joins us now. Professor, thank you very much for joining us on the program. Let me just start by asking straight away, why is this disease, or why is the virus spreading so fast?
Thank you once again. We need to ask why the rodents are moving fast, because the virus cannot go on its own without the vector. It's an indication that perhaps we have the rodents moving around where the cases were reported. And we know the rodents that carry the virus, they are heavy breeders, so they populate very fast. They populate very fast, so we are not surprised. And because we know this is the season when we have more of the rodents in human habitation, the dry season forced them to move into human habitation. And of course, we've observed that in the villages where we have some cases, these were reported very late. And with the late report, nobody knew what they were incubating. The possibility of transmission, human to human, is very high. But I think we are now on top of it. There is sensitization programs all over the 36 states of the country, including Abuja.
All right, Professor, the Minister of Health, I'm talking about Professor Isaac Adewale, has actually described the current outbreak as a national embarrassment when you consider the death toll. 76 have died so far. Just why do we have such a huge death toll, especially when you compare it to Ebola? We only lost 8 persons when Ebola came to Nigeria, but in the case of Lassa, 76. Yet people tell us Lassa fever should not be as dangerous and dreaded as Ebola.
Thank you. It still has to do with the late reporting of cases. Even though we have antiviral drugs that we know works very well, there is little or nothing the drug could do with late reporting. Once they come with advanced disease symptoms, there is little or nothing the antiviral drug could do. And that is the problem. And that's why we are really educating that early reporting is the only solution. If people report early and we pick the disease on time, we can assure you we have 95 to 98% of recovery. But if people fail to report on time, there is nothing anybody could do in terms of helping the situation. But thank goodness, like I did say earlier on, we've heightened the sensitization. All the states, they are at alert. The Honorable Minister of Health called for an emergency meeting among the health commissioners yesterday to appraise the situation in the states affected, as well as the preparation in other states that are yet to be affected. And you also recall that yesterday, the Honorable Minister inaugurated a committee to control the spread of these deadly viral disease.
Let me also quickly ask you, just what would you tell Nigerians now to do to avoid, to prevent the spread of the disease and to even avoid contracting it?
Thank you very much. As part of our educational program, we noticed that people, some people have interest in the delicacy, rodents delicacy. They are advised to, at least for now, suspend that until we are over with the Lassa fever season. And of course, there is jingles all over. There is sensitization on how people can contract Lassa fever. There is jingle on the importance of maintaining hygienic environment, importance of keeping to hygienic practices. All this will stem the spread of the rodents. We are sure the rodents are the ones transmitting the virus particles. The moment we wage war on the rodents by not allowing them to colonize our environment, colonize our rooms, colonize our stores, we are sure the virus will not be able to get to our foods. And we know it is only when they contaminate food, when they contaminate fruits, that people contract the disease. So a lot of health education is ongoing as to how people keep their food from rodent infestation. People are now enlightened that they can easily be infected eating already contaminated food stuff like gari, like bread, like rice, the leftovers that are not covered. People are now educated on this, and I think the practice is improving. And like I did say, if people don't report very early, there is little or nothing ribavirin drug could do. Because by the time they report, the virus moves very fast among the body organs, just the way Ebola virus do. So they have that in common. The moment the virus gets into the system, it spreads.
Could I ask you this? Because there's an impression out there in the public that that it's not possible to contract, that the disease is not transmissible from one person to another. Is that correct?
We have two transmission episodes. We have rodents to man transmission. And once the disease is now established in humans, then we now have human to human transmission. And it is in the human to human transmission we have high fatality cases. Rodents to man transmission, that is about 10 to 20%. fatality cases. But the moment we established the human-to-human transmission, it used to be accompanied with high fatality rates.
So basically, it's transmissible like Ebola.
Exactly, it is. It's highly infectious too.
Finally, Prof, just how bad can this get before it gets better for Nigeria?
Again, come again.
I mean, just how bad can things get before they get better for Nigeria as far as Lassa fever is concerned?
We know from the incubation period, if I get through well, the incubation period is between 6 and 21 days. The virus can be in the body without showing symptoms until after 6 days or thereabout. And one can easily carry the virus moving around the globe within this period. So we've had instances of the virus being exported to other countries, even as far as USA, Germany, and other European countries.
So are you pretty confident that we are going to defeat this the way we defeated Ebola?
Oh, we're already on the track. It's going to be defeated. It's going to be defeated. Like I said earlier on, we know the vectors to wage war against. And then, of course, we've advised and we keep advising our people that once they feel sick, they are having fever, and they're having signs that mimic all those signs shown on our jingles, they should move to the next health facility so that they can be properly assessed and managed.
Well, thank you very much, Professor Milabu, for talking to us and for sharing your thoughts. We just hope things get better before they get worse. All right, that's it on the program. If you want to watch it again, it's simple. Just go to our website, tv360nigeria.com. You'll find the program and lots more there. You can also watch us on our YouTube channel, youtube.com/TV360 Nigeria. Do subscribe to get latest videos and updates. And you can also follow us on Google Plus at TV360 Nigeria, or like us on Facebook. The address is facebook.com/TV360 online. You can also follow us on Twitter. Our handle is at TV360 online. Thank you very much for watching. We're back again next week. See you then.